So coronavirus, believe it or not, was a blessing in disguise for overseas nurses, I think. And I'm going to give you 5 reasons why I am thinking so. So with this whole coronavirus lockdown situation going on at the moment, or that has been going on, there have been some, changes with the NMC UK registration process for overseas nurses, as well as the UK immigration process for overseas nurses. And in this video, I'm going to address 5 of these changes that I think you guys should know about. Okay, so stay tuned. First update I want to address is this message that is going around, that is going viral, I should say, and it's scaring a lot of overseas nurses who are interested in coming to work in the UK, because this message is saying that the UK NHS is no more recruiting nurses from developing countries. And people have been sending it to me. Even if you read the comment section, I think there was a time somebody mentioned it in the comments, and it has been going on and it's scaring lots of overseas nurses, and I'm going to address it today. So I did ask from a very reliable source who is very experienced in this game of international recruitment, and this is what they had to say. So apparently there has been this code of practice for international recruitment, and all the agencies or the NHS trusts are expected to follow this code of practice. And what is this code of practice? What it basically says is that recruitment agencies and the NHS trusts are not supposed to advertise and headhunt for nurses from developing countries. You're not supposed to advertise and target developing countries to fill your short staff levels. And that has been going on for a while. Apparently, this code of practice for international recruitment has been in existence since 2012. So it's nothing new. I don't know why some agencies are making a big deal out of it at the moment. The only thing is the WHO is still telling NHS trusts and recruitment agencies that this code still exists even with COVID. So do not target developing countries because maybe you think they're cheap labor, and then or because you think they are desperate, and then target their nurses. Because first of all, some developing countries are short-staffed because all their nurses are coming to this side to work. And with some developing countries, their government has actually signed a bond with the government of UK. So for them, even with all this, they are not affected. I'm talking about nurses from India and from the Philippines. Although they may be developing countries, this code does not affect them. But it does not affect anybody either, if you think about it, because most healthcare recruitment agencies that recruit international nurses have been following this code ever since. You don't see them advertising. Okay, some people do. I just remembered an agency that actually does that. They actually go to developing countries to headhunt for people. So now you're not supposed to do that. You're not supposed to do that as a recruitment agency or as an NHS trust. But you as an individual who wants a job from an NHS trust or who wants an assistance from a recruitment agency can still contact them. They are not going to advertise. You can contact them and apply for a job. That is allowed. So nothing has really changed with COVID in terms of recruiting international nurses from overseas. The good agencies like MMA have been following this rule ever since. They do not advertise in developing countries and headhunt for overseas nurses. They have not been doing that. So you're still safe to go. But just that some NHS trusts do not want to recruit from developing countries. It may be a bit difficult. What I would say personally as an advice to somebody who wants to come to this side is, I get people contacting me all the time that they've gotten an offer in a care home, but there's so much want NHS trusts, there's so much want NHS trusts, they've heard so many bad things about care homes and they're scared. I'm going to do a video where I compare care homes and NHS very soon. Expect that, okay? But for now, all I'll say is that I've been working in a care home for nearly 2 years and I am good. I have the option of transferring if I want, and now I have my PIN. I see advertisements all the time. The NHS trusts, there's so many NHS trusts that are so short of nurses and are advertising in the UK here for nurses, and I can just leave and go. But I am still okay with the care homes. All I'll say, working in a care home has its pros and cons. Working in an NHS trust has its pros and cons as well. So what I'll say, if you have an offer, they're getting you your COS. What are you waiting for? Why are you waiting for an NHS trust? Come here quick. Let me tell you this, once you get here, you sit for your OSCE, you pass your OSCE, you get your license, you get your PIN, you can transfer anywhere you want. That's the truth. Just that sometimes you are bound by a contract, because when they give you the offer, sometimes they give you like a contract that says you do not have to leave them until after 3 years or until after whatever. But even that, sometimes there is a clause that if you are leaving them, you should pay this amount. If you are leaving them after 1 year, you should pay this amount. And trust me, by the time you get here and you start working, you can easily pay that amount and leave if you want to. So if you have an offer, to me, the most important thing is getting here and getting your PIN. Okay? So when you come here, and you want to leave, you can leave. That is not to say come use the care home as a bait and then when you get here you can leave. You may actually love the care home and then remain there. I have people who have vowed never to work for NHS, and I have people who have vowed never to work in a care home. You may love it. Okay. All right, so all I'll say is that because it may be difficult to get some NHS jobs at this particular moment, go with the care homes and the private hospitals. Okay, you are good. When you get here and you do not like it, you can leave. Nobody can force you. But I'm very sure you would love it. Trust me. All right. And another thing that I'll say is that if you still want an NHS trust, do not let me change your mind. NHS is good. If you still want an NHS, and then your agency is not assisting you to get you an NHS job, don't worry. Make sure you have a couple of NHS trusts in mind that you want to work for. Research about them. Ask people who work with them and contact them directly on their websites. Contact the HR directly and then deal with them. But know that because there are no agencies involved, it may take a longer period. And also know that you may likely need to pay for your visa and your ticket yourself. But don't worry. Once you get here, you get your money back for most people. And even if you do not get your money back, it's worth it. It's worth using your money for such a cause. I mean, when you get here, you make that money and more. So that is all I'll say about this whole thing. Do not get scared. Do not be so anxious that now you cannot come. In fact, they are still short and you still have a chance. Okay? All right. So that is the first update I will talk about. Second thing I want to talk about is the new health and care visa. I'm very sure most people have already heard about this visa. To me, this is one of the best news this year for overseas nurses. We've been through a lot, and I think the Lord God heard our cry and gave us this gift this year. And it came through coronavirus. Like I'm saying, this COVID thing, it has been a blessing in disguise in some way. So if you do not know already, a new visa category has been introduced, right? And it has been available from the 4th of August. And this visa category is for skilled health workers who are coming from overseas to work in the UK. I'm talking about nurses, I'm talking about midwives, I'm talking about dentists, I'm talking about mental health care nurses, I'm talking about skilled healthcare professionals from Africa, Asia, and the Caribbean. You are qualified to apply through this route. So previously, people like myself and any other person who is in the UK and practicing as an overseas nurse, we applied through the Tier 2 General Visa route. So with the Tier 2 General Visa route, I think the application fee was about the visa application alone was about £600, and you also had to pay for your health surcharge. If you do not know, we pay for health insurance, and then because the visa is about 3 years, it's for 3 years, you have to pay for each year. So my time I was paying £200 a year, so for the 3 years it was £600. So 600 plus 600, that was about 1,200 just for the visa alone, because you had to pay before you even go and do your biometrics. So it was generally like part of the visa application fee, sort of, because you have to pay them together. So you were paying about 1,200. Luckily, people like myself, we got support from MMA through our employers to pay this amount of money. But people who were expected to pay this themselves because their employers wanted for them to pay themselves, and then when they get here, they get the money. This was the amount they were looking at. Later on, a few months after I got here, I was told it has been increased from, the visa application was still the same, but the health surcharge had been increased from £200 to £300 a year. So that means £900 for the 3 years, and 900 plus 600, you're looking at about £1,500 for the visa alone. This is excluding your tickets. If you're coming by yourself and then you're being sponsored by your employer, good for you. But if you were coming and then you were sponsoring yourself, this is what you had to deal with. And later, I was told it was now being increased from the 300 to 400 a year. For somebody who was coming with their spouse and 2 children, or their spouse and 3 children, look at the amounts. There are people with large families were looking at about £10,000 to just apply for visa, tickets not included. It was really tough. And now, this new visa category promises to make the process cheaper, quicker, less stressful, and they even have support available for people who need support to be able to apply. And now it has been reduced from 610 or so to 238, and the health surcharge has been scraped off completely, permanently. So now you don't have to worry about any health surcharge, and the visa application is now only £238. Look at that. Look at that. And this is for fresh applicants who are yet to apply, and for people who are already here and are extending their visas. Because when you were extending your visa, you still had to pay this amount, sort of. You had to pay for the visa extension, and then you also had to pay for the health surcharge for the 3 more years you'll be getting. The sad thing is, people with like a family of 4, a family of 5 were paying over 10,000 just for visa extension, and you see people using all the money they saved in that 3 years to just finance for a visa extension, and it was painful and frustrating. You come here, you save money, and then it gets to a point you have to extend your visa, and you use all your savings in that 3 years. But now, what coronavirus can do, you don't know. So now there's no immigration health surcharge again, permanently. Do you understand? Permanently. Done. All you have to pay is the visa application fee, which is also reduced. It's so good, and I am so jealous of those who are yet to apply. Anyway, so that's just it. Okay, so that's the second update I want to talk about. Now I want to talk about the third thing, or the third update. The third thing I want to talk about is the immigration health surcharge into detail. So now, if you paid for your immigration health surcharge on or before 31st of March 2020 as an overseas nurse or as an overseas skilled health worker coming to the UK to work or extending your visa, now you're eligible for a refund. So you just have to apply through the Home Office website, and then you get your money back in due time. And this is great news. Imagine you paying 10,000 and then it's all back in your account. Boom. So good. This applies to fresh applicants who are yet to come to the UK, and for those of us who are already here and we're extending your visas and you paid your money on or after the 31st of March, you're eligible for a refund. And this also applies to our dependents. So our dependents as well are not going to pay. So your spouse and your children are all free from paying healthcare surcharge permanently. I'm so proud to be a nurse, I swear. IELTS or the OET. So if you do not know already, the IELTS has a validity period of 2 years. The IELTS and the OET have a validity of 2 years. And if you're already in the UK, okay, and then because of the lockdown, coronavirus issues, you were not able to complete the remaining process of your NMC registration, and then this whole lockdown thing has delayed you. Now the NMC has put support in place, temporary support in place to help and assist us. So what this means is that if your IELTS was expiring on or between 24th of March 2020 and 21st of January 2020, what you can do is, because by right you are supposed to complete with the entire process before your IELTS expires, and this is why I don't understand. The fact that my IELTS has expired does not mean I am no more proficient in English. I mean, English is a language. If there's anything, to me, it gets better with time as you mingle with people and as you talk and as you learn. So why do you think that if my IELTS has expired and that means I'm no more proficient in English? Personally, I don't understand, but that is what it is. Let your line manager at work give you a reference to say that you have maintained your proficiency in English. And if this reference is satisfactory to the NMC, what they will do is that you can keep your IELTS results. And if it is not satisfactory, what they are going to do is that they will just let you rewrite the IELTS. That will be painful. Thinking about it is like, it will be so painful, eh? For all you know, this person had to write IELTS 5 times, and then because of COVID, it has expired, and the person is being asked to rewrite. This will be so painful. So I hope it's satisfactory for you guys who have to go through this. If it is not satisfactory, you just have to rewrite it. And if the reference is satisfactory and it is accepted, you just have to make sure you write and pass your OSCE within 6 months of the expiry of the IELTS. Okay. You're part of the people using the new process. What happens now is that if your IELTS is expiring on or before the 20th of January 2021, you have to hurry with the remaining process quick and get to the UK and get your license, because you will have to rewrite your IELTS if it expires after the 20th of January. You may have to rewrite it. So make sure you hurry with the process, and then you get here quick and complete the remaining process. Other than that, you will have to rewrite and sit for the IELTS or the OET. So that's it. If you're in the UK and your IELTS expired before the 23rd of March 2020, you know how like suddenly my pace has reduced because I'm sad. You just have to rewrite your IELTS. Imagine somebody has written IELTS several times, has gotten here, and it's by no fault of theirs. They couldn't write the OSCE because there was lockdown and it has expired before 23rd of March. You are being asked to reset the IELTS. You don't have any option again. You're being asked, if it's expired before 23rd of March, you are being asked to reset the IELTS. I'm very sorry, guys, but that's what it says. Now with the CBT, also it has 2 years expiry, but with this whole COVID issue, the NMC is making it easier for you guys. The validity of the CBT has been extended by 6 months. So what this means is that you can now you have 2 years 6 months. So guys, please make sure that if you've already written your CBT, do not let this 2 years 6 months be up before you complete the remaining process. Other than that, you would have to rewrite the CBT. So hurry with the process. Make sure you get to the UK and then you finish the remaining process before it expires, before this 2 years 6 months is up. I think I've mentioned the message that is going about that there's no recruitment for nurses in developing countries, and then I also tackled the new health and care visa. I also spoke at length about the immigration health surcharge, and then I think I also spoke about the IELTS, and I also spoke about the CBT. And let me just give you another bonus update. So now with things easing up a bit, very soon most of the agencies will start job interviews. So what I would advise is that you keep contacting them and then you ask for interview dates, and who knows, you could get an interview date and then be interviewed. But know that with all this thing going on, there were people who were supposed to have traveled but could not travel before due to the COVID. So you have to understand that with all this going on, there is a backlog of people the agencies have to deal with first before they deal with you who is now applying or you who is now beginning the process. Because there were people who had already been granted that COS but they could not travel because their borders were closed. There were people who had been given a job offer but have not gotten their COS because there was lockdown or whatever. So now they have to deal with all these people, the backlog of people, before they deal with you, the fresh applicant. So exercise patience and know that they will deal with you in due time. But just keep your head straight and know that these are not ordinary times. So your process will be quite different because these are definitely not ordinary times. And I'm telling you, once this thing opens and then there's opportunity for you to come, don't waste more time, just come, okay? We don't know when there's going to be another pandemic that is going to even be messier than this. So just come if you have the opportunity, all right? Don't wait for your results to get expired or be close to its expiry. So I wish you guys all the best, and don't forget to subscribe. Next week, the next video I'll upload after this video will be to announce the winner of the giveaway. I'm going to announce the winner of the giveaway and also talk a bit more about myself. So guys, don't forget to subscribe, don't forget to like, don't forget to share, and don't forget to comment as well. I love reading comments and I'm so pleased to hear you people comment and say nice things about the channel. So thank you so much. I'm grateful. Okay, thank you.